Welcome back, everybody. February is Heart Health Month. Let's flip that around there. Are you at risk for heart disease? And what are some of the warning signs, symptoms, if you will, if you're concerned? Well, there's a lot of information you need to know about it, and we're going to try to get it all in here. We're talking today with Dr. Richard Bryan with St. Mary's Regional Medical Center. Dr. Bryan, thanks for being with us.
Thanks for having me, Melissa.
Absolutely. This is a really important topic. Talk to us a little bit about heart disease. It's serious and should be taken seriously.
Yeah, it's a true epidemic in our country. 1/3 of people in this country will die of coronary artery disease. If you're a 40-year-old male, you have a 50% chance of developing heart disease in your lifetime. And if you're a 40-year-old female, you have a 1/3 chance of developing heart disease in your lifetime.
What is it that causes heart disease?
So the traditional risk factors, Melissa, are hypertension, smoking, diabetes, elevated cholesterol, age, and then males have a higher predominance than with females.
Okay, so let's say that we are in that demographic, that area that you're looking at. What are some of the symptoms that we should be looking out for? Is it pain in the heart?
The classic symptoms that should concern somebody would be chest pressure that tends to radiate to the jaw or arm. It can be associated with shortness of breath and typically is brought on by emotional or physical stress. Having said that, there are a number of people, women and diabetics in particular, who do not have classic symptoms.
Okay, so how can someone determine whether or not they are at risk?
Well, what we would do is encourage folks to make contact with their primary care physicians, or we at St. Mary's are happy to see people, and they should assess their risk. They should have their blood pressure checked. They should check to see what their cholesterol is. Check to see what they're doing in terms of exercise, check their glucose levels. And then there are screening tests that we at St. Mary's are offering during Heart Health Month, where we can do calcium screening with CT scans to see if they have underlying coronary artery disease or not.
Now, Dr. Bryan, what's next? Let's say you get the diagnosis. Is that it? Is it, everything is downhill from there? Is there a way to maintain and keep going, or what is the next option?
Well, Melissa, it's important to make the diagnosis because there's so much that we can do about it. Over the last 20 to 30 years, there's been a dramatic reduction in the mortality from coronary heart disease, and that's because of a number of different advances in our field, from bypass surgery to angioplasty, and perhaps most importantly, sometimes it just requires certain medications to radically change the natural history of the disease.
So it can be taken care of. The important part, though, as you mentioned, get diagnosed first. Get to the doctor and get it checked out. Again, that's special for St. Mary's at $99 for the screening. Thank you so much, Dr. Bryan, for being with us. A lot of great information. We appreciate it.
You bet, Melissa.
Thanks a lot. All right, now we go over to Tim with a quick look at our forecast. Hi, Tim.
Good morning to you. We do have some sunshine in some spots, but partly cloudy skies are going to turn mostly cloudy later, and we're talking snowfall in the Sierra tonight. We'll talk about it next.